Paul, it's great to see you this morning.
Great to see you. Thanks for having me here today.
What are you, about 3.5, 4 years into this plan?
Exactly that, yeah. And we're slightly ahead of the plan. You know, when we first came back in 2020 to share what we were going to do, we didn't perhaps realize how much progress we would have made by this point. Certainly on innovation, you mentioned RSV, real breakthroughs just around the corner.
Yeah, you have a much fatter pipeline than you used to. There are a lot of new products that have been coming out. You happy with the pace of things right now?
Well, you know, this is where I'm positively surprised, because we've moved from being good at science to trying to be the best in certain areas, to be first in areas that have never been treated before. You know, if you look at RSV, for example, there is a clear problem across the world, in particular in the United States. It's very difficult to get an emergency care bed for a newborn at the moment in the United States. RSV is really a problem. To be able to do something about it, hopefully to have something approved before the next RSV season, you can imagine what it'll mean to parents and infants.
Yeah, I've been excited to see this, but you're not the only ones with an RSV vaccine at this point. We had Stéphane Bancel from Moderna on earlier this week, and there's also Pfizer and GSK that are working on one. I think theirs is for older people, and yours is for newborns.
That's right. Well, many are for the elderly or older adults. You know, we're first, and we hope best, in infants, newborns. Of course, mRNA isn't applicable in newborns because they haven't built an immune system yet.
Sure.
So, no, we're really excited what it means. And as a father of children myself, we've all been there. We know how unsettling it is, and it's great progress.
Just in terms of competition, though, Pfizer and GlaxoSmithKline, I think they are out with some new research that shows that it can be effective in infants if it's given to the mother first. Is that a problem from a competition position?
Well, I think vaccinating the mother in the hope of protecting the child is a big debate. There aren't many vaccines like that. You know, our approach is to vaccinate you if you're born in the RSV season.
Yeah.
Simple as that.
Yeah.
What's your take, though, when we talked to Stéphane about this yesterday, just the trust issue? And by the way, there's activists outside here, right here in Davos, who think that, this elite group, either misled people or other things when it came to the COVID vaccine and what it was capable of and what it could do, and how you think that relates to, therefore, the trust that people have in vaccines and in mRNA vaccines in the future.
You know, I think we have to accept that the whole industry worked together to try and do the right thing, to try and get the world back to normal. I think it's natural that people want to debate and ask questions further down the line. I think people trust us every day. You know, also this year we'll launch a medicine for haemophilia A to give people a normal life. I can tell you, those patients trust us. They want a breakthrough. They want to live a normal life. And when you're first in class, best in class, and you're bringing hope to people that haven't had it before, it's game-changing.
I mean, Twitter's not the real world, I think, in terms of the... I know what you're saying about the trust for the vaccines, but I think the great majority of people are thankful that, I know I was, that, the worst-case scenario, it may not stop transmission, but it stops the worst-case scenario. It probably stops hospitalizations. I had a real quick question, Paul. You just said infants don't have immune systems, but you're calling it a vaccine, so I don't understand that.
Well, it's a monoclonal antibody.
It's a monoclonal antibody. So you're giving them the antibodies. You're not generating antibodies.
That's right. You're helping them protect. And it's genuinely, the journey we're on, I said we're ahead of schedule.
But you call it a vaccine.
Well, it's an immunization.
It's almost a therapeutic.
It's basically in season for those that need it. It's not for those not.
You give them the antibodies instead of generating natural antibodies.
Absolutely.
Okay, good.
But we're ahead of schedule. We have 27 clinical readouts in the next 18 months.
That's great.
And importantly, we're one of the few companies that has no patent expiration beyond 2023. So every step forward we take at Sanofi now is a really positive step forward, not just for patients, priority one.
And what is the antibody against? What part of the RSV? And is it conserved? It can't mutate around it easily?
No. Look, it's will avoid 80% of exacerbations leading to visits to a hospital.
Okay.
And if you think how full those hospitals are at the moment, that's a big step forward.